Welcome to the series uncovering the latest 2025 American Thyroid Association management guidelines for patients with differentiated thyroid cancer. This is Endo in a Bite, where I break down complex concepts into bite-sized pieces that you can actually remember. Today I'm focusing on recommendations 41 through 44, including radioactive iodine counseling, baseline testing, fertility and family planning, and when to think about external beam radiation. Recommendation 41 centers on counseling around the risk of a second primary malignancy following radioactive iodine therapy. There is a small overall increase in risk, and that risk, while real, generally does not warrant additional screening beyond routine follow-up. What is warranted is explicit awareness and a documented conversation with the patient and the multidisciplinary team so everyone is aligned on monitoring and expectations. Recommendation 42 turns to readiness for therapeutic radioactive iodine and the laboratory studies that safeguard it. Before administering radioactive iodine, obtain a complete blood count to assess overall hematologic status and kidney function testing to confirm adequate clearance capacity. These baseline evaluations are straightforward, but they underpin treatment safety and help confirm that the patient is fit to proceed. Recommendation 43 addresses fertility and family planning, topics that require careful timing and clear guidance around radioactive iodine. For women of reproductive age, a negative pregnancy test is required prior to therapy, and pregnancy should generally be postponed for at least 6 months after treatment. For nursing women, radioactive iodine should not be administered during breastfeeding. Therapy may be deferred until at least 3 months after breastfeeding has ceased, and in some cases, a diagnostic scan is performed to assess safety. For men receiving high cumulative doses of radioactive iodine, counseling about potential risks to fertility is recommended. For women, radioactive iodine has not been shown to impact future fertility. The key point is coordination. Align treatment timing with reproductive goals, and plan the sequence with the care team so patients are not forced into avoidable trade-offs. Recommendation 44 shifts us to external beam radiation therapy. Consider external beam radiation in patients with high-risk features such as aggressive histology, spread beyond the thyroid, positive margins, or involvement of adjacent soft tissues or organs, where the aim is to improve local disease control and reduce the chance of regional recurrence. It is important to be precise about intent and outcomes. External beam radiation has not been shown to improve overall survival. Treatment can carry short and long-term adverse effects, and while chemotherapy is sometimes combined with external beam radiation to enhance effectiveness, that approach may increase toxicity. Consequently, the decision to proceed with external beam radiation is highly individualized, balancing potential benefits in local control against the profile of possible harms. Let me say this in the form of one-liners. Recommendation 41. There is a small risk of a second primary malignancy after radioactive iodine. Prioritize awareness and discussion, and do not add screening beyond routine care. Recommendation 42. Baseline complete blood count and kidney function testing. Recommendation 43. Time radioactive iodine around reproductive plans. A negative pregnancy test is required beforehand. Pregnancy should be deferred for at least 6 months. It should be avoided during breastfeeding and deferred until at least 3 months after breastfeeding has ceased. Counsel men at high cumulative doses, and note that women's future fertility has not been shown to be impacted. Recommendation 44, external beam radiation can improve local control in high-risk scenarios, does not demonstrate a survival benefit, carries potential short and long-term side effects, and may be paired with chemotherapy at the cost of increased adverse effects. Decisions are made case by case. That concludes today's episode on recommendations 41 through 44. Missed a detail? No problem. I have you covered. Head over to easyendoprep.com and sign up for the weekly newsletter. The key takeaways will be delivered straight to your inbox. Remember, stay consistent, and we will work through all 84 recommendations together, one bite at a time.